Good evening, Hal.
We see you in the chat. And it's not that you're not hearing anything. We're not saying anything yet. We're waiting for our fearless leader, the most incredible John Moy. But as we're waiting for him, good evening, Miss Rainey. Um, as we're waiting for him to join, I think we'll go ahead and get started, and John will be able to join us in a bit. There's a few technical difficulties. But let me go ahead and say, on behalf of the Urban League of Greater Atlanta, we welcome you this evening to the next installment of Pathways to Better Health. This is a series that we have been doing for quite a while now, and I'm doing it with my trusty co-host, Miss Shelly Ann McKenzie. Shelly Ann, say a few words to the people, Shelly Ann.
Hi, everyone. I'm Shelly Ann McKenzie, founder of Help for Healthcare Professionals. So, we definitely just wanted to welcome you to session two of our Pathways to Better Health series. We partnered with the Urban League of Greater Atlanta because we share a commitment to health equity, workforce development, and real policy change in our community. So, today's focus is on legislative action in Georgia because it's very critical. And I am glad you're here to be a part of the conversation. Let's get started. We have Dr. Jasmine Clark and Dr. Roberta Ramon with us today. So we're excited to dive right in. Dr. Nelson?
Absolutely. And just in case you guys don't know who I am the proud director of graduate programs at Clayton State University. And this is a conversation that we started. Some of you may have been on these calls where we have all been looking at each other and asking ourselves, what now? Where do we go from here? Wh- What is our North Star? What's going to happen to healthcare? It surely wasn't perfect, but now we don't even know. We're in a holding pattern. We don't know what's going on with our personal health care, what's going on with research that oversees health care, what's going on with primary care or any other type of specialty care. What now? And so I'm very thrilled to have with us our two panelists who are going to go ahead and introduce themselves. As usual, we have some polling questions for you, and then we're going to get into the meat of our discussion this evening. Dr. Roberta Roman, you are new to our panel. Please go ahead and introduce yourself.
Hi, my name is Roberto Roman. I am from Florida. So we are sister states. So we have a lot in common of what's going on in policy and healthcare, and just in general, a lot of similarities. So I am privileged and honored to be a part of today's panel discussion. I am the co-chair of the advocacy committee for DMP as a color, and I'm also on the planning committee for Nurse Shift Change. And then my mortgage paying job is I was just recently appointed as a provost for a private university in Florida.
Oh, fabulous news. Okay,
Thank you.
we have to celebrate Dr.
Yes.
Roman. And then our veteran panelist, my great friend, the amazing representative, Dr. Jasmine Clark. Good evening, Dr. Clark.
Good evening, Dr. Nelson. Good evening to everyone who has joined us this evening. I am State Representative Dr. Jasmine Clark. I represent Georgia's House District 108, which is located in Gwinnett County in the Lilburn area of Gwinnett County. So, right there at the Gwinnett and DeKalb line. I've been a state representative since I was first elected in 2018, serving my fourth term. I serve on several different committees in the State House, but the one that's most apt for our conversation today is the Health Committee. And I am also the chair of the Gwinnett State House delegation, which, if anyone on the call is from Gwinnett County today, I am the chair of all the members of the House that have at least one voting precinct in Gwinnett County, which is actually 22 of the 180 people in the chamber. So I have not done this math problem yet, but that's over 10% of the state house is legislators that represent all or part of Gwinnett County. So very excited to be here this evening and to talk about pathways to better health in the state of Georgia and in our country. So thank you all so much for having me.
Now, Dr. Clark, that doesn't sound like a math problem. That sounds like a math solution to me. We are so grateful for all that you do. And I just want to say a big thank you to you for always supporting nursing, supporting healthcare, supporting access to healthcare. You're always available when we call. You reach out to us for our expertise. And we're definitely valued more because you are so very well versed in healthcare and what the issues are, and you help us to highlight them and make sure that they're understood and respected at the Capitol. So thank you so much for all that you do. Now, before we go ahead and get started, we have got such a great lineup for you. Um, Most certainly sound off in the chat. So we want to know where you're from. We love an active, robust discussion in the chat. We're going to continue to monitor what's going on and try our very best to respond. If for some reason you do not get a response and you have a particular question for any one of us, please put your contact information in the chat and we'll be sure to put ours as well so that we can continue the discussion. So the wonderful Kennedy Smith is on with us, and we're going to ask her to post our very first poll question. Understanding healthcare access and confidence, number one, is the category. How responsible do you feel for maintaining your own health? We want to make sure that everybody sounds off. So please go ahead and answer this question before it times out. Kennedy, can we see the results? Strongly responsible. Somewhat responsible. Now, we would have expected to get somewhere in the middle of these two, but overwhelmingly, 81% of you said that you are responsible for you. Now, if our good friend John Moy was on, he has this great saying that he always shares with us. The cavalry is not coming. We are responsible for us, and we must save us. What does that entail? It entails being knowledgeable about where you are health-wise and for working very closely with your providers and executing the prescription that they give you to make sure that you are keeping you as healthy as possible. Thank you, Kennedy. So let's get into the very first question. And the topic of this question here is healthcare access and economic stability. And that goes into what you were just responding to in the poll. Dr. Clark, I'm going to pose this to you, and then Dr. Roman, you can chime in. What policies should be enacted in Georgia to do the things that we're telling people that they need to take advantage of to care for themselves? Expand Medicaid, lower prescription drug costs, and improve healthcare affordability for our underserved communities, where a lot of them are in the rural areas of Georgia.
Yeah, absolutely. So I think that what you outlined here is the formula that Georgia needs in order to make sure that everybody in Georgia has a fair shot at accessing the full breadth of healthcare that should be available to them. So let's start with expanding Medicaid. As many of you know, Georgia is one of the few states that has not expanded Medicaid, leaving billions of dollars of taxpayer dollars on the table, and actually not even on the table. Billions of taxpayer dollars that we send to other states that have expanded Medicaid. This has then led to things like reduced hospital closures, which we've seen quite a few of in the state of Georgia. That and also impacts people's ability to get to a doctor, healthcare deserts, things like that. Now, I'm not going to pretend like we are not experiencing what we are experiencing now across the country. There is a budget on the table, a federal budget on the table that that outlines cutting lots of money from Medicaid, lots of Medicaid dollars that would come to the states. And so in that instance, Medicaid expansion in this moment would not necessarily help us because a lot of that money is not going to draw down from the federal government in any state. And we're seeing some major cutbacks in the proposed budget. It has not passed, but in the proposed budget. And so that is something that we do have to think about and that we do have to consider in this moment. But the overarching goal or objective of Medicaid expansion is exactly that: expand access to health care. And there are so many Georgians, hundreds of thousands of Georgians right now that do not have health insurance. And to be clear, the governor's alternative to Medicaid expansion, unfortunately, covered a lot fewer people, was extremely cumbersome, including having work requirements, and was very difficult for people to even really interact with the system as a whole, and had very low enrollment. Overall, it completely flubbed as a program, and we truly missed an opportunity over the last several years to actually cover hundreds of thousands of Georgians, and instead we barely covered tens of thousands with the alternative. When it comes to lower prescription drug costs, I think there are lots of different programs out there that, number one, we need to hope stay out there, considering everything that's going on with the federal government right now. But I also think that we have to be mindful of the policies that could either directly increase the cost of prescriptions for many people or indirectly. So, for example, the Biden administration during his time, they did allow for Medicare to begin negotiating drug prices. And that was absolutely essential for beginning to lower the price of drugs for many people. Secondly, as we all know, we all heard about the $35 for insulin, a drug that's been around for literally decades and decades. It's not changing. It's not new. There's no really real innovation behind it. And there is absolutely, positively no reason why it costs as much as it does for many people in our state, other than honestly pure greed at this point. And so, we need those programs to remain intact, the ability for those things to remain intact. And that really does require the policymakers, the people in positions of power, to care about those things and to make sure that we are keeping prices low for everyday Georgians. And then, last thing I'll say is, an ounce of prevention is worth a pound of cure. Making sure that we keep preventative care free or at a very low cost. Honestly, it just should be straight up free. Because if we are making preventative care free for Georgians, it actually saves the state tremendously on the back end when it comes to paying for the actual health care of individuals in our state. We also need to make sure that we are keeping our vaccine programs up and running, robust, and continue to have good vaccine education and push back against this anti-vaccination environment that is threatening us with diseases that honestly, for the most part, we hadn't even really even been hearing about. And now all of a sudden we're having case after case in different places. And so just making sure that we are taking care of the most vulnerable in our communities that can't get vaccinated by making sure that those who can get vaccinated do get vaccinated and that they understand the vaccination schedule and exactly what the vaccines do. So those are just some of the policies that need to be enacted in Georgia. But to be honest, at this point, enacted across the country. We need a concerted effort at both the state and federal level in order to make sure that we are providing policies that keep Georgians healthy and safe.
Dr. Roman.
I was thinking in addition to the policies, what happens if the cuts and the budgets are exactly what they've been proposed? We have to plan for alternatives to see how can we ensure that our communities can still either have access to healthcare, have access to wellness prevention. So, we have to get creative. In this situation, we can't wait for a proposed budget to flip and be like, oh, yes, it's what we're looking for, or it's the compromise. It's what can we do now to ensure whatever happens, our communities are served and have the best opportunity to access healthcare, to get community wellness programs that are reachable, that are in their backyards, that are in their community churches. So having the public step up to really support each other while we're in this gray area waiting to see what's going to happen and who's going to get hurt. Because unfortunately, with these proposed budget cuts, there is going to be like our communities will be hurting more than they are now.
Mhm. I thank you so much for your responses. It goes without saying that preventative care should be free. Ensuring a healthy citizenry is key to everything else, right? This is not banking, this is not transportation, this is not housing, this is not education. This is life-saving preventative care. If we were just to make sure that care surrounding diabetes, cardiac disease, and chronic kidney disease, if we just did those three, you know how many lives we would save? Just those three. And the education that comes along with it, how to do what we say, which is keep yourself healthy and keep people responsible for themselves. Healthcare should be a right for everyone and not just a privilege for some. Before we go forward, our friend John Moy has joined the party. John Moy,
Thank you, Dr. Nelson.
please.
Thank you all very much, and good evening, you all. And thank you so very much. Let me just say, first of all, tonight we're really diving into a crucial conversation about health equity. And we're focusing specifically on communities of color and minority health disparities. And as Dr. Nelson just said, this isn't just a discussion about statistics. It's about you, the listening audience, about real lives, real challenges, and real opportunities to build healthier futures. The truth is, Dr. Nelson, as we all know, that health outcomes are not really distributed equally, and that for far too long, systematic inequities have created significant gaps. For example, to the listening audience, before we continue, did you know that Black women are 3 to 4 times more likely to die from pregnancy related to complications than white women? Or that Hispanic adults are 70% more likely to be diagnosed with diabetes than non-Hispanic white adults? And these aren't just numbers, they represent preventable suffering and a call to action. But here's the good news, Dr. Nelson, and to all of those members of our listening audience this evening, that we've assembled a tremendous group of professionals such as yourself and Dr. Roma and Dr. Clark and Shelly Ann Nelson to really help us to really tackle some of these issues. So I'm sorry I came in somewhat late, but I thank you for your leadership, Dr. Nelson, and for our team, and to once again bringing these important health issues and policies to the communities we serve. So, Dr. Nelson, you continue to take it away. On behalf of our President and CEO, Nancy Flake Johnson, welcome to our listening audience, and thank you all for taking time out to be with us this evening. Dr. Nelson, you take it away.
Thank you. John. The next question is directed to Dr. Roman. And this question centers on community empowerment and how to take action. How do we put this into action? What role does civic engagement, such as voting, community, organizing, and advocacy play in shaping healthcare policies that directly impact Georgia's underserved communities? Dr. Roman, I see something above your head. Nurses shift change. Yes, we do. What's that?
We absolutely do. So nurse shift change with everything that's been going on and the uncertainty, the lack of a guiding star to really tell us where we need to go in healthcare. This movement came about, and nurses, we're the largest workforce in healthcare, but we're not the loudest. So we need to unite. We need to get together because at the front line, we see the problems. We're in the rural communities, we're in the urban communities, we're public health, we're community health. We are everywhere that healthcare lives. And, by this movement moving forward, Nurse Shift Change, we have a rally going on this Saturday in multiple states. Atlanta is going to be hosting one, Rochester's hosting, DC is hosting, Hartford, Connecticut's hosting. So
Chicago.
nurses are going to be rallying together for humanity, for ethics, for social justice, and for sciences. Because right now we have a lot of things under attack that is going to hurt our communities. We are looking at budget cuts in multiple levels. And, when we talk about civic engagement, a huge part of that is knowledge. It's understanding what these budget cuts mean, what it means when the National Institutes of Nursing Research has been cut, what it means when the National Institutes of Health budget has been cut, when you're looking at HRSA grants, so federal grants that support educating future healthcare leaders, providing funding for research grants. When these budgets are cut, our health suffers. And we're not going to feel it today. We won't feel it tomorrow, but give it a couple years when access to healthcare is worse. When currently, right now, we have information, websites that talk about HIV/AIDS, that talk about LGBT health, that talk about STIs, that talk about COVID, that talk about TB, that talk about illnesses and diseases that are attacking the most vulnerable of vulnerable communities disappearing. We talk about going into the dark ages. We're losing valuable information that our clinicians, our healthcare providers use to help treat their patients, and also valuable government information that has been published. It's already been paid for by tax dollars. The research has already been there, and this information has been posted and is publicly free on the internet, gone. So now we are introducing ignorance to years of knowledge that we have come a long way from. And just as quickly as they're wiping out websites, we will be sliding back. So when we talk about civic engagement, it's talking about understanding what policy is doing to us, what it's doing to our community, what it's doing to our colleagues, what it's doing to anyone around us. Even if you don't identify with a community, you are an ally of that community.
Right.
Healthcare is collective. So civic engagement is the understanding of what's going on with policy. It is the going out and verbalizing and vocalizing what you want to see done. It's contacting your representatives like Dr. Clark and saying, hey, this is what's going on in my community. What can we do to make it better? Asking those questions so she can ask other people what's going on, other experts in the field, or if you know what's going on and what the solutions are, making those recommendations. Because we vote our representatives into place. The policies that are happening now have been voted into place. These are representatives that are doing what they are supposed to do, which is represent their people. So if you didn't vote, if you didn't go out, if you didn't lobby, if you didn't campaign, if you didn't talk to someone, if you didn't have a conversation with a friend, you're not engaged. And a lot of people are like, how do we start? How do we go? What can we do? It's by opening a conversation and informing yourself and connecting with people.
Can I add to that really quickly? I 100% agree with everything. I think that education and information is so important, so vital right now. And also, if it wasn't important, they wouldn't be trying so hard to erase it and trying so hard to make it unavailable to people. So I do think that's important. But one thing I want to point out is that right now we are in an election season, and it might feel like we're always in an election season, but in 2026, all of the statewide offices in the state of Georgia are up for reelection. And a lot of people that are running for those offices, running for governor, running for attorney general, running for PSC, which are the people who control your light bill, running for the state school superintendent, the person who plays a major role in what's going on in the schools in your community. All of these people are up for reelection. And a lot of the people that are running for office for these elections are actually elected right now. Not all of them, but a lot of them are. And so right now in this moment, there is this tension where they want your vote. And so you have the opportunity to reach out to them and mention, hey, I noticed you want my vote, regardless of what side of the aisle they're on. This is not a partisan issue. This is a straight up policy issue. You want my vote. What are you going to do about X? What are you going to do about the cuts to healthcare? What are you going to do about the cuts to education? What are you going to do about the threats to the democratic process and the voting process? What are you going to do about the fact that half of my neighbors just lost their job to Doge and Elon Musk? What are you going to do? And you are in a position right now where they feel like they at least need to have some type of answer because they want people to vote for them because they are running for these different offices. And so the unfortunate thing about it is a lot of times people are motivated by the next election. I do think that's unfortunate because that means that a lot of times they are their ear is only to the ground when they think they're going to get something out of it. But now is that time. And so I would encourage people to, number one, know who already represents you and know what their voting record is. Secondly, after you know who represents you, look into who is running for these offices and ask, what are they doing? What are they saying? What types of bills are they proposing? What types of bills are they voting yes or no on? What is actually going on with the people who are already there? Do I think they are doing a good job? And if you don't, reach out to them and tell them about that. If you do, reach out to them and tell them that as well, because they need to hear that too. Because a lot of times when we are in these positions of power, we also want to make sure that the things that we are doing, the way that we are voting, that people are actually appreciative of those things so that we can keep doing it. If we don't hear from people, sometimes we're second guessing, like, is this what people want? The point of being a representative government is that we are actually one voice that is representing thousands of voices. We actually need to hear those voices. So it's really important to engage your elected officials, such as myself and my colleagues, and also engaged candidates as they are running to get your vote so that they can get into these offices.
Dr. Clark, I just want to ask one question because you said something that a lot of people, I think, kind of miss the mark on, right? When they say get in touch with your representative, a lot of time, the lay person thinks as, representatives almost like celebrity status, that they're untouchable, right? They're at the Capitol, they're at their office, not sure how to reach them, how to contact them. In your personal professional experience, what is the most effective way for just a lay person to get a hold of their representative?
So in this technology age, the truth of the matter is email is one of the best ways to do it. But here's the trick. This is the important part. Start your emails with, hi, my name is such and such. I live here. I am your constituent. That is immediately, if y'all have a pet, y'all know how when the dog hears something, their ears perk up. That's what happens with elected officials. Because now all of a sudden it's like, oh, this person has a real stake in whether or not I get reelected in some way or another. So, yes, make sure that they know you are a constituent. And even if you aren't a constituent, that doesn't mean you can't reach out to people who have some say so in a policy that's important to you. Let's say, like a chair of a committee or something of that nature. Still reach out to them and say, I'm a Georgia voter. And this is important to me. Because again, they might not be running for election now, but or running for something else now, but who knows what they might decide to run for later, and they might still really be receptive to what everyone has to hear. But yes, I think email right now is one of the best forms of getting in contact with people, but it needs to be a personalized email. The chain emails, while they are great, we get like hundreds of them all at once. Usually we open the first one, maybe the second one, and we realize these all say the same thing. We can kind of bank that, all right, clearly there's a big group of people that care about this particular issue, but the personalized email is something that really does matter.
Now, Dr. Clark, can I just add one thing? Lord, we're not going to get through these questions tonight, but this is really important information. Also, when you are sending an email, you're going to send an email to Dr. Clark. She already told you she's on the health committee. Personalize it, which means, Dr. Clark, my name is Dr. Michelle Nelson. We went to high school together. My wife is a nurse practitioner. My cousin is a something. Whatever. Dig deep, grasp it, whatever. But try to put that personalized nugget into your messaging, because we're more apt to respond to people that we know, that we have a connection with. And at the end of the day, and I'm going to say this, Dr. Clark is here. Dr. Clark is the employee. You are the employer. Your tax dollars are paying her salary, and you therefore should have a voice in saying the people that work for you, are they performing? Are they hearing your voice? And most importantly, just like when you go to your job and they give you tasks to do, and you are there to execute what your boss has told you to do, a strategic plan, whatever it is, it's the same thing for her and her colleagues. Her number one thing is to pass a budget. Am I right, Dr. Clark? That's the one thing that has to be done in Georgia, is pass the budget annually. All other things are gravy. But if she's not hearing from you, don't think she's not hearing from someone. She's hearing from someone, all right. And what she's hearing and what they're asking for can run counter to what you, your family, and your community needs. So it behooves you to get up, stand up, speak out, and let her know what your needs are. And then hold her feet to the fire. Don't just go vote for Dr. Clark. Get to know her. Is she representing you? Then go all out and stand up for her, because she needs you too. She's got stuff going on in her community and she wants you to show up for that. But if you want her to show up for you, you show up for her. But you got to show up. If you don't get anything else tonight, you got to show up. Now, I already told them they got 2.2 nanoseconds to speak. Look at me. I'm going off. We're not even doing the poll questions. Kennedy, let's get back on track with the poll questions. I'm putting it over to Shelly Ann McKenzie. I'm shutting up now. Microphone.
Listen, such powerful perspective, but the show must go on. So, understanding healthcare access and confidence. How confident are you in your ability to navigate the healthcare system? Want to make sure your vote is counted. So go ahead and make sure You get your response in there before it closes. Okay. How are we doing, Kennedy? Okay. And the results are, interesting. Okay, 29% very confident and then 29% neutral. Love to delve into that, but that might be a whole nother topic because we know we have technology mediums that can help us access and personalize our care. So the goal as we move forward with these conversations and these pathway to health platforms and questions and so on is to help you figure out how best to navigate the healthcare system, how to advocate for your health, and how to advocate for the health of your communities. So thanks for sharing there. And the future of healthcare is prevention. So the next question is about preventative care, chronic diseases, and vaccine equity. So, Representative Clark, what legislative steps must Georgia take to ensure equitable vaccine distribution and improved access to preventative healthcare services? Not just the well-resourced ones, um, you know, go ahead.
Yeah, absolutely. So I kind of alluded to this a little bit earlier. When it comes to equitable vaccine distribution, we need to acknowledge healthcare deserts in our state. Because here's the thing, right now, there are many programs that make vaccines pretty much free for most people, especially childhood vaccines. But what good is free if I can't get to it or if it's not coming to me? So, acknowledging healthcare deserts and centering policies around bringing the healthcare to the community, such as mobile clinics, health fairs, empowering our community-based health clinics to go out into the community, bringing it to that school open house, bringing it to, the places where people are congregating and making sure they have not just the vaccine, because we shouldn't just go around sticking stuff in people's arms, but the information about what this is for, why this is needed, who should get it, and who shouldn't get it. All of these things are important. So when it comes to equitable vaccine distribution, I think the biggest thing is acknowledging that everybody doesn't have a doctor and everyone does not have a tradition of going to the doctor. If you're growing up in a household where you don't have access to health insurance, your parents didn't have access to health insurance, the idea of going to the doctor might be extremely foreign to you. And sometimes the only time you know you need a vaccine is when you try to enroll that child in school, and all of a sudden the school says, "Where's your vaccine records?" And you're like, "Oh, where do I even go to get that?" And so we have to do a better job of making sure we're bringing, as Dr. Roman said, the information as well as the vaccination to the community. When it comes to improved access to preventative healthcare services, again, bringing it to the community, bringing the community to it, letting people know where they can go, where they can get affordable healthcare access if they don't have insurance, and also making sure that we recognize that preventative care isn't just screenings. So, for example, one of the things I didn't bring up earlier is access to nutrition services. Unfortunately, in the state of Georgia, not all health insurance plans, although many of them are starting to, but not all health insurance plans cover nutritionists. But when I think about preventative care, I don't just think about sticking a needle in someone's arm for a vaccine. Vaccines are absolutely vital to public health. But preventative care is also teaching people the best how to eat a balanced diet so that you can prevent certain diseases that are associated with not eating a balanced diet or not getting certain nutritions. Preventative care is also telling people, not just telling people, hey, you need to exercise, but also making sure people have access, safe playgrounds, safe walkable spaces. Like all of these are overarching policies that we really need to think of. When people think of preventative care, we really need to think of what are the things that are causing disease and what are the ways that we can prevent them. Yes, vaccines are just one of those things. Screenings to make sure your vision is on point, your hearing is on point, your blood sugar is on point, all of these different things. Very good. But also, how do we prevent disease? And a lot of that has to do with what we eat and how we move and how we handle stress or put ourselves in stress or out of stress. All of these are part of that preventative care. And so we need policies around that. And that does not always necessarily mean something specific to going to a doctor. Really quick, we talk about social determinants of health. And I do believe that there are social determinants, things that are not necessarily healthcare related, but that are related to your health, such as access to parks, transportation so you can get to a doctor if you need to, having a livable wage so you can afford your medicine and afford that healthy food and afford to get to the doctor, put gas in the car so you can get there. All of these are part of what I think of when I think of preventative care.
Oh gosh, thank you again, Representative Clark, because your focus on equity and prevention underscores one vital truth that early intervention is only as effective as access. So if you don't have access, you won't have what you need. So we will move on to the next question. We have some really important questions that we want to make sure that we touch on at least a little bit for tonight. So let's shift to the future of healthcare. Did you have anything to add, Dr. Rahman? Because I'm coming
I
to you.
I could always add something. What
Yeah, go ahead.
Dr. Clark mentioned about access
Mhm,
answers one of the questions that our attendees asked about why do you think 40% of the people don't get their wellness exams? And
mhm,
AARP says only 20% regularly
mm,
get a wellness exam. A lot of it goes back to access. And then
mhm,
what Dr. Nelson mentioned also to communities. What is your perception on a wellness exam? What is your perception or your experience with vaccines? I can tell you within my community, within the Latino Hispanic community, if it ain't broke, don't fix it, right? So we're not going to seek healthcare until something is
broke.
deadly wrong, or we have experiences of someone going to the hospital, finding out they're diabetic, and all of a sudden now they're on dialysis because we
Mm,
waited too long to screen for
mm,
that.
mm.
So a lot of factors here. So that's all I'm going to say about that piece. I'll let you go back to your question.
No problem, but thank you for sharing. So
Can
as
I
we,
stick in
oh,
one thing? I know I said I was going to be good.
all right, go
I
ahead.
just can't be tonight. Another thing that is an issue is trust.
Mm,
Trust of the me, big grown age Dr. Nelson. When I go to the doctor, I'm running the doctor. Now, I shouldn't be doing that. I really shouldn't. But sometimes I don't feel confident that they are going to really. I mean,
dig
Dr. Mom,
deep
you
and
know
try.
what I'm talking about, Dr. Clark. When I go there, I've already, because I know so much, I've gone on with my differential diagnosis. I think I already know what it is. These are the tests that I've come here to get. You only ordered two things, but here's the other 22 that I want you to add on so I can see my labs and I can supplement with some vitamins or something. How's my vitamin D level? How come you didn't ask me about that? I told you I have chronic low vitamin. Like, that's a real thing. And if it's me saying these things, then other people are saying them too. And
Yeah.
this is why it is so important. It is why it is crucial that we educate ourselves.
Mhm,
Okay? This is not just getting up and dancing boots on the ground. Everybody's got a fan dancing boots on the ground, me included. It must be really boots on the
the ground.
ground
Mhm,
and
mhm,
understanding where you are health wise and where you want to be. and work with your provider because there's such a thing as patients' rights. You have rights. You don't just show up at the doctor does what practice medicine and do what they want to do to you. You have to have skin in the game. Go and ask questions. I'm not saying be a PubMed and an internet doctor. That's not what I'm saying. But going there and saying, I came today, you didn't look at my skin. Can you please take a look at my skin? Can you please take a look at my feet? I am diabetic. I shouldn't be home chiseling down my own nails. Can I get a referral to the podiatrist to cut my toenails? Like, you gotta be on point and on top of your
Mhm.
stuff. Thank you, Shelly Ann.
No problem. But another goal we have as we host these Pathway to Health series is to give you some type of targeted roadmap. So we tell you practical steps, we share practical examples, and we talk about the targeted legislation and any type of outreach mediums that you need to engage in or things you need to do so that you can have the roadmap and the actual steps to take better care of yourself. So let's now shift to technology innovation and digital health solutions. Dr. Roberta Ramon.
Oh my God. Go ahead.
No pressure, right? Get ready. How can AI driven diagnostics, wearable technology, and remote monitoring tools be integrated into public health initiatives to improve early detection of chronic diseases?
We're living in such an exciting time when we talk about technology. The fact that now your scale that you do your daily weights on, your watch that's telling your time, your heart rate, telling you your steps in the day,
And your rhythms.
now your insulin pumps are on your iPhone or your
Mhm.
Android. All this stuff is now there, but the question is, who has access to it? Who's
Mm.
going to have the ability to afford an Apple Watch, to get an iPhone that can do the your
The cardiac
monitoring your blood
rhythms, the
sugar,
heart rhythms.
all of
Yep.
that.
Mhm.
So it's a pivotal moment here, and we're not even go into the data privacy part of this right now because that's a whole other podcast that we can have on where we're going in the future with data security and privacy.
Mhm.
But with the technology that we have and the amount of big data that is out there, everyone is now familiar with ChatGPT. You can take your results from a CAT scan, have not a clue what any of the words mean, put it in ChatGPT and say, translate this to me in like lay terms, and it will tell you exactly what it is that you're dealing with. So when we talk about AI has the ability to look at trends. So we talked about Georgia and the high Black maternal mortality rate.
Mhm.
If you have a heart rate monitor, if you have an Apple Watch, a Fitbit, there are trends that AI can capture to say that this person could be preeclamptic. The question is, who is engaging in these
Mhm.
opportunities? Which doctor's office is going to have the capacity to have the software to be able to monitor that and to be able to operationalize and put action to it? Right now, you're seeing it more so in concierge medicine.
Mhm.
We're not seeing it in public health yet. And when we talk about prevention, what is a better way to know that someone could be going into an irregular heartbeat than an Apple Watch saying, hey, you had a couple skipped beats, a couple times throughout this, and it's getting worse. The Apple Watch now, I think, can tell you like your risk for falls. So it actually gives you like like your risk for
Mhm.
falls is higher now because you have an unsteady, you've been unbalanced for a while. And I've been getting those alerts from my dad because my dad
Yeah,
is,
it's
an elderly
unsteady. Mhm.
person. He's,
Mhm.
starting to use a walker and things like that. And I'm getting those alerts there. So he's connected to me, as a son and dad, he shares his information. But why aren't we sharing this information with our providers? Where is the gap that providers would have to upfront the money to be able to handle this type of software? So I worked at Vital Bridge Health, which is a primary care practice that we started in Boynton Beach for uninsured, underinsured, marginalized communities within that area. And we did that. We had, the smart scales. We had the glucometers that we were able to give to our clients. And we were able to get a lot of the stuff donated from the actual companies, right? And then
Mhm.
when we talk about insurance and not insured, it's very interesting how prices change. So if you are insured and you have diabetes, your insurance isn't going to cover a continuous glucose monitor until you're on high levels of insulin, have maybe an amputated leg, might be on dialysis, have been considered a complicated patient with
Case.
diabetes, right? That's when they'll say, you know what, we'll give you a continuous glucose monitor to see how you can do this better. Well, we flipped the script. We're able to get them donated. And if you're not using insurance, you were able to get a coupon to buy about 2 weeks worth of the sensor for $70. Our patients would say, you know what, I will, do $70 to see what's going on for 2 weeks and talk about a learning opportunity. When they would take that bowl of cornflakes in the morning, drink it with their orange juice and their coffee with creamer and sugar, and realize that their blood sugar has now skyrocketed to 300, guess what habit we just changed? Guess what alert we just got at the primary care practice saying that so and so's blood sugar is now sustained in the 300s for a couple hours because of what they ate. So, why are we doing this backwards? We know as adult learners, we always ask, what's in it for me? So, if I have that continuous glucose monitor and I was just newly diagnosed with diabetes, I can see how things impact. So, a lot of opportunity to bring in technology, to use AI. We're seeing AI now come into hospitals. We're seeing it come into scheduling software for appointments. And it's a whole other podcast on how these algorithms are created and what it's doing and how it's doing. But the technology is there, the machine learning is happening, but we as consumers, as constituents, need to be in tune to what's happening and ask our providers, hey, are you doing this? And if they tell you no, well, why not? Is this something that you're looking at doing soon? Do you need to look to another provider? Imagine the connection between the rural communities if there could be a center that's monitoring this information on a regular basis and can phone in. Why don't we partner with the universities that have nursing schools, that have medical schools, and have the residents and students monitoring this stuff remotely? There's a lot of opportunity here that we have not tapped into, and it's a matter of getting the right ear and getting the right organizations that are willing to do these types of partnership to reach people that don't have access to immediate care. Because with telehealth, COVID showed us how valuable telehealth is. You don't need to go to the doctor's office for a lot of different things, and you can still get good, appropriate care.
Can I add
Yes, go
something
ahead.
really quick? I know we're on a time crunch, but the only thing I would add to that is a lot of times Black people, people of color, do not participate in these types of things. And AI is learning. It is artificial intelligence that is basically gathering information and learning from that information. If people of color do not engage with these types of things, then we are literally not a part of the data set. We are our parameters, our numbers are not a part of the data set, and that's missing. And then when they create standards, the standards don't actually fit us because we were never included in the data in the first place. So that's why it's actually truly important that in order to have truly representative data, we need to get this technology to all in the community instead of the haves that can access this stuff because they have the money to. We need to get it to everyone so we can actually see trends, we can actually understand what's going on, and so that the AI is actually getting good data from a robust breadth of information. So that's also really important to this conversation as well, because I don't think we talk a lot about how a lot of our standards are not based on people of color, because like we are never really a part of the clinical trials, and we're just never a part of how those standards get created in the first place.
Yeah, no.
Spot on.
Dr. Clark, I
Yeah.
think sometimes that goes back to, well, a lot of times it goes back to trust,
I was going right
right?
there. The
You can
trust
speak
factor.
to a lot of Black people who will say, Tuskegee. What is Tuskegee? I don't know what that is, where that is. I don't know if it's something I smell, eat, rub on my skin, but that's the answer to everything. And it's like, okay, but in order for us to be able to move forward, we've got to have you. And we have to, as providers, be able to dispel those myths. And all of them are not
Educate,
myths.
educate.
That's a true something.
Mm-hmm.
But the myths that might be going on in their minds right now, that we're out to get people, we need you to be engaged, involved, and ask those questions. And also, how are you protecting my privacy?
Mm-hmm.
Ask it.
Mm-hmm.
Make them show you. Don't just go sign a HIPAA paper. What's happening with my information? What are you doing with it? Okay, so
Ask
don't
those
be afraid
questions.
to ask those hard questions. Shelly, and I think we've skipped a few poll questions. I
Yeah,
want to ask two
mhm.
back to back, but looks like you're trying to say something before we go to the poll questions. Go ahead,
Yeah, so
please.
before we go, no, and I was just going to say it's a responsibility of all of us to educate related to AI and educate the community as to the pros, the cons, and the benefits and all of that. But then it's also the responsibility of the vendors. I've worked for software vendors, and the goal is or should be to build the inclusion in from the start, right? Building all the data, but making sure you have the right sample size of individuals so that the data can get learned. So that's how we shift from going from innovation for like innovation's sake to innovation that's actually transforming lives. I think we should just go ahead with the next poll question. Oh, go ahead.
But Shelly Ann, someone asked a question
Okay.
in the chat that I think we should. There's a poll question, and do the poll question, and I'm going to address that question.
All
What
right.
do
You
we
saw the
do if we
question.
think
All
our
right.
doctors are not listening? Please address this poll question.
Go ahead with the poll, Kennedy.
It's up.
Okay.
Is it?
Yes. Understanding healthcare access, how confident are you in your provider's ability to keep you healthy?
Mm.
Hmm. And then you answer the question in the chat. We could talk for 3 hours.
Because Bishop Robin and Bishop Clark are preaching tonight, honey. I don't know. We need more time. Bishop Clark? Ooh, you got a word for the people tonight.
Representative Dr. Bishop Jasmine Clark.
Okay, Kennedy, what say you with the poll?
Oh,
I think I have a bit of a prescription for that as I address this question in the chat. Next question, Kennedy. I want to do two back to back.
For the poll? Okay.
Two polls back to back because I don't want us to lose them. Aha.
All right. Understanding healthcare access. Again, how knowledgeable are you about the standard annual healthcare screenings recommended for your age group? From mammograms to PSA testing for prostate, colonoscopies. And thank you, Marcella, for dropping that in the chat. Places with low cost to free care in our communities. All right. Getting ready to close out the polls. Everyone get your answers in. And then Dr. Nelson, you could go ahead with the response once this closes out. Okay.
So we've got some work to do, folks.
Yeah.
And that leads me into this particular thing from Antoinette Prince. I don't have my glasses on, so I'm reading all kinds of things. Does that say Antoinette Prince? I think so. How do we get our doctors to listen? I'm just going to tell you this about my my mother-in-law. My mother-in-law calls me all the time and says that she had a knee replacement, and she swears up and down that the doctor put the wrong size This thing is double the size, and this is why she can't walk properly. And as much as I explained to her that that is not the case, that she has to do the work and do the rehab and do the da 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 da, you gotta work to make it work. But the issue for my mother-in-law is she's very hard of hearing. She's losing her hearing. And so she half hears and has her other things in her mind. She's, in her 80s, has formed her own opinions, and you really cannot get them out. She believes that her doctor doesn't listen to her. You know what I do? I will fly from Georgia to New York to go to the doctor with her, or make sure that someone goes to the doctor with her, so that it's not just her feeling that the doctor is punching down on her, that there are other people with her who can also ask the questions, who can also give her the confidence to have her voice heard, and to also hear what she can't. So it's very important that before we go to the doctor, that we know what we're going about. That's one. That we're knowledgeable about what we're going about. Two, when we get there, we ask the questions. You don't have to listen to me. But as you can tell from my personality, you're going to hear this mouth. And it's not going to stop until I get my answers. It has to be that way. And so therefore, it is important. Hold on one second. It is therefore very important that we go together. Don't let your elderly or your elders go on their own, because they're going to come home and feel like no one cares about me. So make sure that we as a community, that we are communitying, that we're going together. When people come home from the doctor, what did the doctor say? Do you understand? If that is not affirmative, you're going to get on the line and speak with the doctor. Don't just take what they're telling you. Regine says, I'm a firm believer that doctors are our partners, not God, and they can be fired if they don't listen. You're darn skippy. Like my mother tells me, your money doesn't have any name on it. Take it elsewhere. If you feel like you're not getting justice, you're not being heard, change providers. Okay, let's get into the next question. Shelly Ann McKenzie, anybody else something to add here before we move on to the next category? Okay, so the next one focuses on policy advocacy, sustainability, and accountability. Representative Jasmine Clark, this is for you. How can Georgia residents and advocacy groups hold state legislators accountable for prioritizing healthcare funding and advancing policies that reduce disparities in medical treatment? That's a good one. Dr. Clark.
Yeah, and I think that a lot of what we have talked about this evening really has captured the answer to this question. And that is, number one, your legislator should know you. You know, when I first decided I was going to run for office, before that, I was like, I'm just going to register voters. And one of the issues that I found with registering voters, it is very important that we get people registered to vote. But a lot of those same people that we went out and spent all that effort to get to register to vote, they didn't actually go out and vote. Like, they were registered, and that was like the last step that they took in the democratic process. We need to not just be registered to vote, but we need to actually vote. And when we vote, we actually need to know who we are voting for. I teach a policy and advocacy class in the nursing school. I taught one in the nursing school, and it was very interesting to me how most people, when I said, "Did you vote in the last election?" everyone would raise their hand. But then if I asked them if they remembered even 50% of the names on that ballot. Most people didn't. They don't remember. They just remembered, oh, well, I voted with the person with the D next to their name because I consider myself a Democrat. Or I voted with a person with the I next to their name because they're the incumbent. And so far, I feel like everything's fine. So I didn't see any reason not to vote for them. But they couldn't tell you their names. We have to have a culture of not just voting out of reflex, but voting for with a purpose, with intention. And when we vote for people, know who we voted for, and then reach out to them and tell them what's important to you, what's important to your community, how this policy that they are pushing will impact your family or the people in your neighborhood or the people at your school, or we really should have much more of a relationship with our representatives than a transaction with our representatives. It's not just enough to vote and walk away. It really does. Like, I have people in my community that even now I know who I can call if someone says, oh, I'm having an issue with this. There are certain people in my community that I know I can call them and ask them about that subject. You know why? Because they have made meetings with me and they have told me, hey, this is what I do. This is what my organization does, or this is what I do for a living. If you ever need help with anything, if you ever have any questions about the subject, please feel free to reach out to me. Number one, now I know there's someone in my community that really truly cares about that subject or cares about that policy. And I'm going to have my ear to the ground if that policy comes up in the state capitol. But number two, I also have a resource. I actually reach out to my constituents sometimes too and say, hey, I know you have an organization that helps new mothers find diapers when they can't afford diapers. Can you help me with that? I have a constituent that just reached out to me. Or, hey, we're voting on this policy that has to do with prostate cancer. I know that you have dealt with prostate cancer, or people in your family have dealt with prostate cancer, and now you reach out to a lot of organizations and that deal with prostate cancer, and you reached out to me and talked to me about these things. I would really like your opinion on this policy. Do you think it would be helpful or not? That's a relationship. And when you build that, and you don't have to build it with every single person, but at least choose someone at the state level, choose someone at the local level, engage them, let them know that you care about these policies. And I promise you, when the relationship, a relationship is better than a transaction. And you will get so much more out of your elected leaders if you are in relationship with them and you know that you can reach out to them. And when you reach out to them, they're gonna reply back. And they also know that when you reach out to them, you're expecting a reply. And if you don't reply, I'm gonna call your admin and I'm gonna ask them to set up a meeting so we can meet in person, because I really want to talk to you about this thing. So that's really, really important. And that's something that I think that everyone should do. Just take it that next step. That's my biggest advice as being a state representative. And I haven't been a state representative that long. So even before being a state representative, just being a regular person, take it that next step and get to know the people that you are electing, know what they're about, and let them get to know you.
Dr. Roman?
Very well stated. I don't have anything to add to that.
Well, I have something to add. The master of engaging with representatives is sitting here before you, Miss Shelly Ann McKenzie. Shelly Ann, I'm about to out you, okay? I remember years ago. Well, no, a few years ago, I was talking to Shelly Ann. Was it on a live or on a Zoom or something? And I said, hold a second. Is that Senator so-and-so in the background eating jerk chicken? Oh, wait a minute. You remember that, Shelly Ann?
Oh, yes.
Oh,
He stopped
yes.
by. He was having
And the person is now currently in big leadership.
Big leadership
at the Capitol.
at the Capitol.
Okay? The
Mhm.
person was in the corner. I said, oh, I see how it goes now. With that being said, these are real people. The individuals down at the Georgia Capitol are not demigods from Mount Olympus. They are your everyday folk who take their duty very seriously. And guess what, folks? They're no different than you. If you're good and disgusted and tired of being tired, get up and run for office. Get up and run for office. Jasmine Clark wants to see change. A lot of people who were in office, guess what? Reached out to a legislator about something that was extremely important to them and did not get the response that they wanted and said, you know what? Like we say all the time, we're going to vote that bum out. And the best way to do it, run yourself. Is that true, Dr. Clark?
Yeah, absolutely. And I just want to also point out something that you said. I have amazing conversations with my constituents at the grocery store all the time. At the grocery store, in the park. The reason why I'm able to do that is because when I'm in the grocery store, they see me and they say, that's State Representative Jasmine Clark. They don't just know they voted for the D on the ballot. What they know is that they voted for Jasmine Clark. And not only do they know they voted for Jasmine Clark, they know they voted for Jasmine Clark with the chocolate skin and the natural hair that's right over there in the grocery store in aisle number 4 picking up dog food. And I'm just going to go over there and say hi. One of the things I will say is when I am in my community, I am always aware that there are people in the community that are engaged enough that I'm paying attention at all times. But what I will also say is being a part of your community is what I mean when I say relationships. It is that thing that when someone has an issue and they post it in the local Facebook group, the first thing that someone will comment is tag Representative Dr. Jasmine Clark. She'll help you. She helped me when I needed X, Y, and Z. And then there you go. But that is because they have relationship with me and they know if you just reach out to her, she's able to help. And so that is how you really, truly, I really think that's the way representative government is actually supposed to work.
Mm-hmm.
And Dr. Nelson, there
Well,
was something that you said that I want to tag on to as well. You said that, our representatives are not demigods from Mount Olympus. That means they don't know everything. That means that they aren't healthcare providers themselves that are voting on legislation that impacts healthcare. That means, some of them in some states will be potato farmers that are voting on different things. So it's a matter of us sharing our stories. So when we're talking about Medicare cuts, Medicaid cuts, and you have either yourself or a relative that has been impacted by the changes in prescription insurance, or just healthcare insurance in general, they need to hear those stories because the the policy will be written, but we don't know every single nook and cranny that it's going to impact. And this is where, we end up with donut holes and people fall through the cracks because of the way policies are written, can't cover every single circumstance out there. So when these things happen, you need to contact your representative saying, hey, my, copay just went up this amount of money on my fixed budget. I can't afford that. Or I just lost my life-saving medication because it's no longer covered under this prescription plan. And this is where our representatives need to hear our stories. And if you are in healthcare, anyone in this panel or attending is in healthcare, share the stories of your patients without any information. We're not violating HIPAA here, but you need to share those stories that you're hearing and seeing on the front line on that patient that keeps coming back to the ER because their medication isn't covered only for a month or so. Those are the stories that we have to keep sharing to make sure that policy is written to help prevent these types of lapses in coverage or loss of coverage.
Dr. Roman, the last question will be yours. Kennedy, do we have another poll question, or we did all our poll questions?
One,
Quickly. What is the
one,
biggest barrier to healthcare in your community? Ready, weigh in. Okay, Kennedy? Cost of care is astronomical. Misinformation. I don't even know what I don't know. I'm not a doctor. I'm not a nurse. A lot of people don't have insurance. There's not enough providers, particularly in rural Georgia. We've had so many hospital closings. The cost of care, you know, physicians are moving out of rural areas and going more to Metro Atlanta. Where are we getting primary care from? There's just so much to unpack here. But these are the types of discussions that you have with your legislators and say, this is what is important to me. And what is your plan legislatively to address them? Let's go into our last question. Dr. Roman, community empowerment and taking action is the category. What role does civic engagement, such as voting, community organizing, and advocacy play in shaping healthcare policies that directly impact Georgia's underserved communities?
I think we've hit a lot of this already in today's discussion. So this is a great question to kind of help wrap it up. So civic engagement goes back into education, right? Knowing what's going on, knowing what's happening, not only registering to vote, but going out and actually voting and knowing who you're voting for. And there's different resources out there that will help people kind of educate themselves on what's going on. One of the ones that I recommend a lot is called 5Calls, the number 5calls.org, 5calls.org. And what I love about that, you can download an app, you can go to their website and just, look for policies that, impact you, that you're interested in, that you want to support, that you're passionate about, and start connecting with your representatives about that. And then in the chat, someone's already included, I think Shelly Ann included the link to know how to contact your representative, who your representative is. I think 5Calls does the same thing, but it starts there. It starts by getting that information, and once you start seeing the impact that you can have, and to one of the attendees' point, it might not be easy. You might not be heard. You might not get the response that you think you should or get it in a timely fashion. Be tenacious. Keep going, keep advocating, keep connecting, and start rallying people. We have, again, this is why nurses are doing this nurse shift change, because we're rallying together because we're tired of our broken healthcare system. So we have this movement going, we have people connecting, we have people advocating, we have people calling, we have people donating, we have people that are making a movement to make sure that what we need in healthcare is actually heard and that we see movement towards it. So there's so many different ways that you can get engaged at whatever level you're at. A lot of people, especially when I talk to nurses, don't know how to engage. Campaigning for someone that they believe what their policies are, their voting record, campaigning for them. I'm sure Representative Dr. Clark, you need the campaigners, you need the people to support you, to go out in your community. It's those grassroots effort that really does elevate the voice of the communities we need to hear. And also, don't live in a silo, right? Maybe you're in northern Georgia and you don't see or hear the issues that are going on in the rural area, or it's not impacting you. We talked about how healthcare impacts everyone. We need to be allies for the communities on what's going on. We have to understand what's happening. We need to understand the difference between equality and equity. So it's not that we're saying everyone needs to get the same exact thing. No, we need to make sure that the people at the bottom can get to where they need to be to have the best quality of life, because we do deserve good quality life. So understanding where we're at, knowing how we can engage, knowing how to share your story, right? That's another thing. People are like, well, how can I just talk to someone about, whatever topic it is? The personal example I can share with you, I was at one of the Hill Days with the nursing organization, and this was a couple years ago when they were talking about cutting the HRSA budget. So we're talking about federal funding specifically for nursing education. I went to this Hill Day. I had no idea about policy or politics other than what I saw on TV or House of Cards or any of this stuff. So wasn't sure what to do. So I was like, I want to educate myself. I want to learn what's going on. And they had representatives talk to the group of nurses. We went and met with staffers, representatives. And, my story at that time, and I didn't realize it was the story that I needed to share, was how a federal grant, a HRSA grant, gave me the opportunity to go to the University of Miami, get a bachelor's, post-bachelor's certificate in education, and then granted me the opportunity to get a master's in nursing education for about $10,000 from the University of Miami, which will cost you a lot more than that. And my employer at the time covered a lot of that tuition. So when we're talking about federal grant funding cuts, specifically for nursing education, I am a person of color. I am Hispanic. I do, I am the diversity that we want to see in the workforce. This grant gave me that opportunity to be a voice for a community that isn't often represented throughout the US. So that was the story that I was able to share, was how this specific grant gave me the opportunity to be the nurse that I am today.
That's phenomenal, Dr. Roman. And
I
how
won't
fortunate are we to get the nurse that you have become today? Dr. Clark?
Yeah, I won't belabor the point. I think that we have really covered everything. I echo what Dr. Roman said, and I just want to say, tell your story. Um, Dr. Roman brought up something, Dr. Nelson, you brought it up as well. A lot of the people at the state capitol, at the US Capitol, congressmen, senators, the representatives, you name it, they don't know everything. Like literally, they do not know. And so a lot of times, the first time they truly understand the gravity of something is when someone just like you comes up to them and tells them, because of this policy, I lost my home. Because of this policy, I can't afford my medicine anymore. And then it's like, and I will tell you this, as a state representative, the number of times we've had a bill, it passed, and everyone was all like, oh, yay, it passed. And then the next session, we're fixing it because someone in this community said, because you passed this bill, this happened. And they're like, oh, that's not what I meant to happen. That wasn't the intention. And so then we have to go and we have to fix it. And so you communicating with us is actually truly important for making good policy because we don't always get it right the first time. And so that's really important.
What a powerful evening we had. Powerful. Did we get all our poll questions in? We got all our questions answered. We heard from our attendees. Our panelists were on fire. John Moy, have we done what we came to do this evening, sir?
Well, as my son would say, you crushed it. Slam dunk.
And left no crumbs. And left no crumbs.
Crumbs.
Powerful, powerful indeed.
I want to thank everyone for joining us this evening. It has been my pleasure to host along with Shelly Ann McKenzie, and we're very, very grateful to Dr. Roman and Dr. Clark for their expertise, for their words of wisdom, for their motivating discussion, for the inspiration to get up and do more, to feel confident, and to make sure that we can reach out and not just be an advocate for ourselves, but for our families and our community. Like we said in the very beginning, you got to show up. You got to speak up. We want to see all of you on Saturday. You don't have to be in healthcare to join this rally. If you know anything about healthcare, if you care anything about healthcare, if you've even heard the word healthcare, you belong there on Saturday. Okay? 11 to 1. Be there or be square. We got legislators, we got rousing speakers, we got a DJ. You
We
want to
got a
come really
DJ.
do some boots
Yeah.
on the ground? Come do some boots on the ground.
Come meet
I'm a
Dr.
fan.
Clark. Come meet me. We'll be down there. And this was such powerful dialogue indeed. And, if we want better healthcare outcomes, we need to be bold, have tech-enabled solutions, and unite as a community. So that everyone needs to hear our voice. So let's turn this momentum into action. We will see you this Saturday and next. All the information is in the chat. Please feel free to share it within your networks on our website and social platforms at Helpful Healthcare Professionals. The Urban League is sharing it as well. And together we can make some things happen and we can shift change.
We want to thank Kennedy for helping us to put this all together always. Boy, she's the most patient and kind soul. Thank you, Kennedy, as always. John Moy, we turn it over to you, sir. Take us out.
Thank you, Dr. Nelson. And thank you to the listening audience for an incredible, insightful discussion we've had this evening on better pathways to healthcare. I want to extend a huge thank you to our phenomenal panelists, led by Dr. Michelle Nelson and my good friend Shelly Ann McKenzie, Dr. Roberto Roman, and my good friend Dr. Jasmine Clark, and our affable and erudite Master of Ceremonies, Kennedy Smith. Your expertise this evening and dedication to this crucial topic have illuminated so many important considerations and actionable strategies. And to you, our listening audience, thank you for joining us once again and for your encouragement and engagement. We hope you found this webinar valuable and that it sparked further thought and discussion in our communities. We truly appreciate your participation. On behalf of Nancy Fleck Johnson and the great team at the Urban League of Greater Atlanta, we thank you so very much for taking time out of a very busy Tuesday evening to spend a little time with us. Thank you all very much. Be well and God bless.